So now with mineral deficiencies, what's the difference between vitamins and minerals? So vitamins are going to be organic compounds, where your minerals are going to be ionic compounds or elemental compounds. Like calcium. You gotta have calcium. Without calcium, you're going to have bone loss. Chloride, without enough chloride, you'll have alkalosis. Iron, without an iron, you'll get anemia. It's really important in the formation of blood. Also fatigue, brittle nails, sore tongue, and pica. Pica is a behavior that you see in people sometimes where they eat things that aren't normally considered food. This is not uncommon in individuals who are pregnant. I had a professor once, and she was like, when I was pregnant, the smell of rain made me want to eat dirt so bad. Which could have meant that maybe she was having an iron deficiency, because being pregnant takes a lot of iron. You got to make a lot of blood for you and that offspring in you. Phosphorus, without phosphorus, you get weakness, bone pain. It's associated with rickets / osteomalacia, abnormal bone growth. It also has like weak, soft bones. Potassium, without it, hypokalemia. We talked about that before. Weakness, cramps, also irregular heartbeat. You remember potassium is really important for the repolarization of your heart. Sodium, super important. Really, in that extracellular fluid, it's important to have sodium to cause like the influx for nerve conduction. So you'll see stuff like mental apathy without it. Also cramps, because your muscles need it to depolarize. Weakness, nausea. So with your sodium, again, also really important in fluid balance. We talked about this last time when we were talking about diuretics and how when you want to retain water, you also retain sodium. If you want to get rid of water, you also get rid of sodium. Low sodium can cause a decrease in your blood volume because you are not retaining that water, right? You're getting rid of it. Biologic saline is 0.9%. That is the concentration of sodium in your blood, in your extracellular fluids. Then we get to potassium. Potassium is an important intracellular cation, where sodium is more of an extracellular cation. Really important in muscle function, like cardiac muscle. So without a lot of potassium, you can have low muscle tone, paralysis, and even cardiac arrhythmias. Here you can see how acidosis can cause hyperkalemia. Hyperkalemia can cause acidosis. Alkalosis can cause hypokalemia. Hypokalemia can cause alkalosis, or making your blood more basic. And then we get to calcium, typically associated with bones, but you also need it for muscle contraction. If you remember, calcium binds, or it gets released from the sarcoplasmic reticulum that binds troponin to move tropomyosin, so you can have that myosin-actin cross-bridging. It's also important in blood coagulation. You don't want to get too much calcium because it can also cause kidney stones. And so again, with all things in life, you need to find that balance. So here is your recommended food consumption. So this is how you don't get vitamin and mineral deficiencies or essential amino acid or fatty acid deficiencies. For a healthy adult, you need 2 servings of milk, cheese, dairy a day, 2 servings meat, poultry, fish, beans a day, vegetables or fruits 4 servings, and then 4 servings of bread, cereal, whole grains, that kind of stuff. As you age, you actually need to eat more of this stuff. Something that we see in seniors is that they actually lose their appetite. Probably because they're less active, they're using less energy, but also just through senescence. There's a lot of stuff. Except for any like confirmed deficiencies, if it's not like, hey, you have rickets, you need more potassium, right? Or sodium or whatever it is. Without a confirmed deficiency, you're not supposed to take supplements. And then on top of that, a lot of your supplements aren't regulated by the FDA, and so you don't know what's really in them. Just a note to keep in your head. Here in these groups are just kind of showing you what consists of a serving. So like a slice of bread is a serving. So you can eat 2 sandwiches a day to get your full bread amount, right? Half a hamburger bun or a bagel, a 9-inch flour tortilla, half a cup cooked pasta, rice, or cereal, 2 or 4 crackers, depending on the size of your cracker, right? For your fruits and veggies, about half a cup berries or vegetables, or juice, 3/4 cup of juice. Lots of easy ways to get your minimum daily servings. And just note that just because it's organic doesn't mean it's healthy for you. So organic junk food is still junk food. I didn't fact check this, so, don't hold me to it. But you really are what you eat. Without your vitamins, without your minerals, you can't have proper functioning. In the next group, we'll talk about atherosclerosis and our hypolipidemics.